Hi, welcome to the Heart Brain Health Fair. Welcome to this session, Alzheimer's, What You Should Know, with Dr. Richard Caselli. A few housekeeping items before we begin. If you need to use the raise your hand button to ask a question, it can be found under the More tab with the 3 dots, and then under Reactions, and then you will see the button to raise your hand for any questions you might have. And without further ado, I will pass it off to Dr. Richard.
Great. All right. Well, welcome everybody. I apologize for not being there in person. I had intended to be, but on visiting my grandkids, I'm afraid I picked up something and now at home with a runny nose and a little bit of a fever, so I apologize for that. But this should work fine. I understand most of you are online as it is, so we'll work through this together. Okay, so let's go to the next slide, please. And the next one after that. So I'd like to start just with some basic definitions. We talk about memory loss as we get older, and that is indeed a fairly common phenomenon. There's been all sorts of studies that have looked at memory loss with age, and I'll show you a slide in a moment that sort of depicts that a little bit more graphically. But that should be distinguished from an actual pathological process or disease. So there is some age-related memory loss, but when we speak about actual diagnoses, there are a couple of diagnoses, terms that you'll hear: mild cognitive impairment and dementia. And I'm often asked, what's the difference between dementia and Alzheimer's disease? So just to start with, Alzheimer's disease is a very specific disease process. It's very gradual in onset, and it builds up over the course of many years before a person even begins to have any symptoms. As it builds up in our brain, the first symptoms that we almost always see are problems with memory. Of course, that can make it questionable. Well, how do you know when it's just age-related versus when is it Alzheimer's? And that's not a simple question to answer, other than to say that there's a change in the pattern of forgetfulness. We all forget things from time to time. We might repeat ourselves. We might forget where we put our keys. But, these things happen in the course of everyday life to pretty much all of us. If we start seeing one of our loved ones who keeps asking the same question over and over, and it's not characteristic of them, that's when we might start to worry about it. And that early symptom of Alzheimer's is what we call mild cognitive impairment. At that stage, people seem to have abnormal degrees of forgetfulness, but they're still functioning pretty well. They're still functioning pretty independently, which is one of the reasons why it can be a little hard to recognize at first. They seem fine otherwise. As the disease progresses, it starts to affect them more and more, to the point where there's no question about it. And as it reaches a stage where people can no longer function independently, that's when we use the term dementia. So neither the terms mild cognitive impairment nor dementia are actually the names of a disease. They're really just a description of symptoms. Alzheimer's disease is a very specific disease that causes dementia. This little picture that you see on this slide in the yellowish brown, that's a picture of what's called an amyloid plaque, or a neuritic amyloid plaque, which is one of the characteristic things that we see under the microscope in the brains of people who have passed away with Alzheimer's disease. On the bottom in that pink and black slide, those black streaks there are actually called neurofibrillary tangles. And what they are basically are brain cells that have essentially died with an accumulation of a protein called tau. Tau is an important protein in terms of brain cell structure and function, but under the influence of Alzheimer's disease, it becomes damaged. And in damaging tau, it ends up killing the brain cell. And when it's stained in a special way by a pathologist, it forms these very characteristic appearing neurofibrillary tangles. And this picture that you're seeing here of the amyloid plaque and the neurofibrillary tangle, that's the neuropathological hallmark of Alzheimer's disease. Let's go to the next slide, please. Now, this is just a graph to depict what we mean when we talk about age-related memory decline. So if you look on the slide here, on this axis here is a memory test called the AVLT, or the Auditory Verbal Learning Test. And this is a test that we give to people who go through neuropsychological testing, in which we give them a series of words that they have to remember over a series of learning trials. And then after a delay of maybe a half hour, we come back and say, do you remember the words on that list? And there are 15 words in that list altogether. And you can see that an average performance is somewhere around 10 words. Now, as it turns out, men and women differ a little bit in their verbal memory abilities. Women tend to be a little bit better than men. Women are depicted in red and pink here, and men are depicted in blue and in light blue. And what we see is that over a series of learning trials, women get better on this test with each successive trial, but with age, that degree of improvement starts to flatten out. Now, the difference between the red and the pink here, there's a gene called ApoE4, which is a common risk factor for Alzheimer's disease. It's present in about 25% of the US population. It differs somewhat worldwide. And people who have that particular gene tend to show a steeper degree of age-related memory decline than people who don't have that gene. We see that in both women, and we see that in men as well. What you're seeing here is that women always retain that superiority over men in terms of this verbal learning test, but they seem to decline at about the same rate as men do on it. So this is an example of what we would normally expect in terms of age-related memory changes. Can I go to the next slide, please? When a person comes in for evaluation of Alzheimer's disease, what can they expect? So first, there's just the office visit. When somebody comes to see me, I'm trying to get a history of what's wrong, what's going on, what are the symptoms. And of course, I'm expecting to hear something about memory loss. And it's always helpful to have concrete examples when you're speaking to the doctor about memory loss. What are some examples of what you're talking about? In addition to forgetting things like, well, we took a trip last month and he doesn't remember any of the details from that trip. There are other symptoms people will sometimes talk about. For example, language-related problems. Coming up with names is a very common one. We went to go see our grandkids, and he was having trouble coming up with their names, which seemed very uncharacteristic. So, those are the sorts of things that,